I'm Johanna Dawson.
And I'm Kendall Rogers.
And we're the PAs here at Granite Bay Dermatology. I'm talking today about some of the common rashes that we're seeing this summer. I'll talk first about what we call Intertrigo. It's kind of a non-specific term, but generally encompasses rashes that we're seeing in the creases or folds of the body. Commonly, this starts as what we call kind of an irritant contact dermatitis, meaning that when you have skin-to-skin contact and sweat in between, the sweat can start to irritate and break down the skin, resulting in kind of this moist, red, patchy rash popping up within the folds. This can be further complicated by overgrowth of a yeast called Candida, which is generally presents as these little red bumps popping up around the periphery of the rash. Generally speaking, when we're treating this rash, if we have both things present, we're treating two different problems. So we often use something to calm down the inflammation of the first rash, caused by, again, irritation from sweat. We often then need a second prescription to more specifically address the yeast as well. I always talk to patients about prevention. This starts as an irritation to sweat. So because of that, we always talk about drying measures. So things to help prevent the sweat from being in these areas for prolonged periods of time. That can take the form of drying powders that we can, again, apply to the creases of the body. There are also different moisture wicking fabrics that you can buy, for example, from Amazon, where you can cut the fabric and tuck it into the bra or into the undergarments as well. We always talk about cotton undergarments as well, tend to be a little bit more breathable than other fabric. Something else that can be helpful is when you're bathing, taking a hair dryer and using that for the folds of the body to make sure the area is bone dry before applying clothing.
I'm going to talk about contact dermatitis, specifically dermatitis that we see in the summertime related to people brushing up against some plants like poison ivy or poison oak. We'll see people come in with red patches, sometimes blistering if it's a very severe presentation of the rash, and it can be quite itchy. If you have any of the symptoms and you remember that you were hiking recently or working out in the yard, it might be something that you need to get evaluated, and we can help treat you with some topicals or maybe in some cases even oral steroids. The other rash that we commonly see in the summertime is heat rash, also known as Miliaria. It is a rash that can look like a bunch of little red bumps, commonly in areas where we're more sweaty. We tend to see it in patients that are coming from hot or humid environments or patients that have high fevers. We can also see it if you have been bundled up in more layers, and it can be quite itchy. A good treatment for it would be a topical steroid, so it might be something you need to have us check out. You can also use supportive care like stripping off some more layers and wearing cool cotton clothing.
That being said, these are just general things to watch for at home. It's always helpful to have an in-person discussion. Other rashes, unfortunately, can look similar, so if you have a rash this summer, just come in and see us.